welcome to Community Pulse, a CAN TV program featuring local leaders and organizations focused on improving health and well-being in the city of Chicago. My name is Megan Phillip, and I am your host today from the Healthcare Council of Chicago. Community Pulse is presented in partnership with our partners Foxglove Alliance, and which is a public healthcare coalition supported by the Hextone Institute of Medicine, as well as the Hextone's Nurses and Humanities. I am one of the rotating hosts, so I'm proud to be here today. As we sit, it's still August, and throughout this month, we've been celebrating what we call Illinois Free and Charitable Clinics Month. So joining me today are two representatives from Chicago Women's Health Center, AJ Barks, the Interim Executive Director, and Scout Bratt, the Outreach and Education Director. Welcome.
Yeah, thank you, and happy Free and Charitable Clinics Month.
Absolutely. Well, I'm grateful to have both of you here. And would love to learn more about, the Chicago Women's Health Center facilitates the empowerment of women and trans people and young people by providing access to healthcare and health education in a respectful environment where people pay what they can afford. So tell us a little bit more about your mission and the services and where we can connect with you folks.
Yeah. Well, thank you again for having us. Over the last 50 years, we're about to celebrate our 50th. Yay! Our services have grown, and they now include gynecology, gender-affirming trans health services, mental health services through counseling, alternative insemination services, integrative health services that include massage, acupuncture, pelvic floor physical therapy. Did I miss any?
Outreach and education. Did you say that already?
How about
sexual health education in Chicago public schools and community-based organizations?
Wonderful, wonderful. So, I would love to continue, as we think about you as a free and charitable clinic and you work with many partners, why is maintaining this approach so crucial at this time?
Yeah. We believe at the health center that everyone deserves access to quality health care in which they're treated with respect, and that the communities we serve have historically lacked both access and respect in healthcare settings, and that includes women, trans people, people of color, low-income folks, people who are uninsured or uninsured, and so we operate using a sliding scale across all of our services. And that sliding scale is self-determined because just as we believe people know their bodies best, we believe they know their finances best. And in fact, 97% of the health center's clients plan to return to us for care, both because of that access and because of that respect.
That's awesome. So a little bit more about some of the preventative focus that you have. How important is it to maintain that preventative care? We often sometimes women's health care often gets kind of pushed aside as sort of a piece of the puzzle that doesn't always get enough research, enough backing. So as you think about educating and also offering those services, would love to learn more about how you treat those patients and keep that regularity, as well as how you open the doors for education and opportunities.
Yeah. I'll get started and please jump in.
Sure.
But preventative care is so important. It's important, one, because it is way less expensive than problem-oriented or emergency care. It's less expensive for the person accessing care as well as the clinic providing it. It's also a means by which we can identify things earlier and therefore have less intensive medical interventions be necessary. And then really important to our model at the health center, it allows people to work toward their health goals rather than just be responding to health crises. So there's more opportunity for health education and collaboration with a trusted provider rather than just, here's this thing, we have to address it right now. It just creates some really important opportunities.
Yeah, and I think the model we have in our clinic as well as outside the clinic in our outreach and education program really focuses on someone engaging in learning about their bodies, about their options, so that then they can make informed decisions for themselves, so that it is a proactive way of engaging with one's body, relationship to healthcare as an institution, so that it's an ongoing relationship someone has, something they're consistently thinking about and having opportunities to make decisions in, as opposed to just responding or it being an emergency crisis moment, as AJ said.
Sure. So as you think about our youth, especially, how are you engaging and what are those programs like?
Yeah, so we are a part of a network of Chicago public school vendors, as well as people who work in area universities, college-age students, specifically to provide comprehensive sexuality education, which really focuses on people learning about bodies, relationships, identities, and is meant to be really focused in informing people on not just options they have, but how to use skills in negotiating those options. So a lot of what we do is try to essentially take the model of engaged collaborative health care in our clinic outside of the clinic. So folks are beginning to sort of get experience from 4th grade all the way up in how do you ask questions about your body? How do you ask questions about your options? How do you tell someone what your boundaries are? How do you talk about what your health goals are or what your relationship goals are? And we believe that if folks are beginning to practice that from elementary school all the way up to adulthood, through adulthood, then when they come to the health center, they're going to feel really at home because we're ultimately using those strategies in each of our visits.
That's awesome. And I feel like that's so critical for especially the populations that you're serving are people that can't necessarily afford or have challenges financially. So making sure that they feel really empowered to even ask questions and be curious is really important, because I think even those that have the privilege don't even always feel confident to ask the right questions because there's a lot of taboo and stigma around how we even talk about health in general.
Totally.
So I would love to talk more about the providers that you have. You have a staff of 23 and 50 volunteers. So how do you manage the balance of that administrative and direct services and smooth operation throughout your coordination?
Yeah. Real quick, I just want to respond to something else you mentioned, which was, something else that we haven't talked about yet is like, we also believe that good care takes time. And,
Sure.
As Scout was describing our model, like our visits are longer because people, even people who aren't low income aren't often given the time in visits to get their questions answered. So it's not just about the ability to ask a question, it's about the time to get your questions answered.
Yeah.
And we want to hold both.
Absolutely.
So.
And I think that's so important. I think so often we're rushing through life, we're rushing through these appointments. If you've spent the time to come in for a visit or spend that time online, you sometimes are also in a fragile state of understanding what you're feeling or what's going on. So I really appreciate that that extra time spent that I think sometimes gets lost in some of our traditional models of delivery of healthcare. They are delivered by some of your staff and volunteers. So tell us a little bit more about how that model has come to be and how you started as a volunteer yourself and how that has influenced your role.
Yeah. So I feel so lucky to work with the team that I do. And the way that we operate at Chicago Women's Health Center is actually using a modified collective structure. So we are, a 501c3 nonprofit, but our highest level decisions, our most important decisions, are made by everyone in the organization. And that really supports people's ability to have, buy-in in those decisions and get information. And so I think that, that is really important to us, being around 50 years later, but certainly really struck me when I did come as a volunteer that immediately I was invited into some really important, impactful conversations that shaped my understanding of healthcare that I still carry forward into my role today. And so, the modified collective structure, I think we also, do a good job of emphasizing that administrative roles and program roles are not a binary, right? We're a feminist organization. We have no problem disrupting a binary. We want people who are in programs to understand, the operations of those programs and be part of that and vice versa. And so we try to really make everything very permeable to all staff in terms of understanding why we do the things we do, both so they have that information and they are bought into it.
Yeah, I think also another component of that is knowing that if we're trying to create a care system in which people are collaborating on getting more information, working towards one's health goals, we want to be collaborative in how we're working with one another so that the model of care that we are using is also permeated throughout our entire organization. So it's collaborative, it is transparent, it is focused on ensuring people have enough information to make informed decisions for the organization, and that's true throughout all of our programs, as well as those big, major organization-wide decisions. So
Yeah.
it feels also like we are trying to build the world we want, both in every clinic, every class, and every meeting we have.
That's amazing. And what you had shared earlier was there has been an evolution of some of the services provided. So I would love to see, both of you have been there for over 10 years. So as, the world evolves, you have evolved to be there for more than 50 years and really understand that women's health is not binary. It's ever changing in what we know and research, and also being able to meet the needs and the questions of community. So would love to hear about, some of the newer things and offerings that have become apparent that you felt were important to add. And then from your perspective, would love to hear about, the evolution of how we're talking about things and how we're educating about those opportunities.
Sure. Yeah.
Yeah, I mean, I think that we, throughout our time as an organization, have been responding to the needs of our communities. We listen. And that is what drives our evolution. That's, you don't see a lot of 50-year-old feminist health collectives out there anymore. And I really believe we're still out there because we have not been afraid to evolve and reimagine and, in communities, really seek to understand what is the legacy of the health center as we carry it forward. And that really what roots that legacy is our model, as Scout described it, right? That across all programs, we're practicing that model. Across every program we bring on board, we are going to apply that model. And so I think that, people return to us for different services, changing and emerging services, because they can trust that they will still receive respect, the information they need, the collaboration they need, and the respect they deserve.
Yeah, that's great.
Yeah, I think a lot about the evolution of our trans health programming and how when we were focused only on providing preventative gynecological care without an analysis of how actually trans folks were already coming to the health center, we just weren't including them. To me, it feels like if we are really truly listening to our clients and to our students and to our community partners, opportunities for evolution and in general expanding in a more inclusive way are plentiful if we're listening. So one thing I will say specifically is the menopause workshop is something that we just recently developed, and it was something that people who had been coming to clinic, people who've been emailing and asking the health center if we talk about menopause, had asked. People who inside the clinic were like, we should be talking more about this. I want to learn more about it in a community educational setting. And so we created a workshop. Two of our very expert health educators created this workshop, and we'll be offering it this upcoming year multiple times with the idea that people are asking for this information and they trust that the way that we will be providing that information is going to be values aligned, rooted in medical accuracy, feminist approach, challenging the myths and the misinformation that is widespread, specifically about menopause, but also about, in general, hormonal healthcare and hormones. And that people are going to come to us because they know we have a long history, 50 years, of working in a collaborative, direct way that affirms people's access to knowledge.
Yeah. And I'll say also is an extension of the services we're providing with young people, right? We don't think that you stop learning about your body at the end of puberty, right?
Right.
So
Totally.
I feel like there's all these different levels of our generational differences as we're on a spectrum of our own health. And so it's great to see you guys taking it from very young all the way up to, I think, sometimes our forgotten aging generations, because suddenly we're just like out to pasture or something.
Right.
And I think it actually, there is a lot of movement in spaces and places to be more forthcoming about talking about menopause in a more open manner, because there's been so much taboo around it previously that we just don't talk, don't tell, that we're experiencing anything. And I think we're starting to realize there are multiple symptoms and experiences that people have never shared, so we don't actually know how to support people. So I think those workshops and just having that doorway open is so important and powerful.
And I think for us in particular, naming that and then speaking to it is deeply feminist and is deeply aligned with our model of both healthcare, health education, but also our mission that is also saying we want to empower folks, which also involves being in community with people as you learn about why this has been so de-emphasize, or why there are so many myths, or why we are not talking about it before now, right? And we have been, but the health center for sure is wanting to make sure people have places to go throughout their lives to think critically and in community about their health care, their health education, their bodies, their relationships.
Yeah, we also similarly are launching peer health services in our gender affirming trans care, and in the fall in our counseling program for that exact reason, that we want people to have community around their health goals, their health challenges, and that working with a health center staff person or provider is an important person to have on your team to work with, but so are other people in your community and helping people build that. So I'm super excited to be bringing on these group visits as an extension of what we're already trying to do in one-on-one visits.
Yeah, so how do you think about that from both treating youth and working with in CPS or other educational organizations, empowering students and people that they have certain permissions and challenges with what they can and can't share, and having parental guidance, and how are you kind of matching and supporting in ways that help people with their family planning, with their individualistic planning, and how do you kind of find those allyships and help with not only just the patient but their allies and their peripheral supports as well?
Mm-hmm. Yeah.
Would you feel okay?
Sure.
Yeah.
Well, first I'll say that we definitely, when we're working with young people in school settings, it's always in groups, which again, peer influence is very strong throughout our lives, but in particular during adolescence. So those group settings, we are encouraging folks to think individually about their relationships. We absolutely encourage individual questions, but it's not the same type of dynamic that we have in our clinic when we're working one-on-one, mostly with adults. So for the most part, when we're working in classrooms, what we're talking about is who else in their school landscape or their own neighborhood and community landscape are the adult allies that they could talk to get that more individualized support around boundaries, around options around puberty. Who are the youth-focused clinics we can make recommendations to for accessing STI testing if someone is 17, if someone is 16? Though in the state of Illinois, 12 years old and older, you're legally allowed to get access to certain types of healthcare without a parent or a guardian. So just a note. In particular, though, I would also say our work with adult allies, specifically in educational settings, is focused on that. Is how do you become a support person to the individual young folks in your life? So if you're a teacher, if you're a youth worker at an organization, young folks are going to come to you with questions. How are you engaging in an open, inclusive, affirming way that might be similar to the way we do our sexual health care in our clinic?
Yeah, which is about, as we've talked about, providing health information, going through multiple options, there being time to ask questions about those options, and ultimately it's a collaborative decision that we're supporting someone in making, and that it's not, and again, it gets back to the preventative care. We're trying to treat these conversations as working toward goals rather than what did you come in to fix and how quickly can we get it fixed.
Yeah, absolutely. So, as we kind of look at the system level, I'm so proud that you all act as a free and charitable clinic as well. So like the sliding scale is there for people to feel financially empowered. But, as you think about your role in the spectrum of free and charitable clinics and the impact that it has on our uninsured and marginalized communities, how is this culturally competent and very feminist-driven care impacting our communities in a different way?
Yeah, please jump in.
Yeah.
And I will say, I think some things that are true about the health center are also true about free and charitable clinics across the state, in whose company I'm so proud to work, in that we are more deeply rooted in communities. Our staff, our board, our volunteers reflect that, and that we are, able to see concerns or opportunities emerge and respond more quickly. We can be more adaptable than most other places in the healthcare sector. We are also incredibly scrappy and resourceful, right? That when we see a need, we can respond and we can do it quickly and effectively because we're responding with solutions made for those communities, the communities that we're a part of. And yeah,
I think with our school partners in particular, because we are offering our services on a sliding scale and are part of the Communities and Schools of Chicago network, which provides services free of cost, it means that we are able to sustain those relationships because schools aren't trying to come up with a budget every single year to pay us. So now we have students we've seen from 4th grade all the way through their 7th grade year, and this year we'll see them as 8th graders before they graduate. And that means that they have a relationship with our health education program, with individual health educators, that is a source of trust and information that they can hopefully use to inform the rest of their lives. So I think it's about being able to continue deep relationships within set communities, within set schools.
Yeah, and I think you guys are already kind of alluding to your approach and your goals, but as you said, you're approaching 50 years. I'm always a future-facing person, so what aspirations do you have for clinic operations or the impact that you have, and what are some of the sort of forward-facing goals that you have as a clinic?
Yeah, I will say it feels very true to me that the health center is every bit as relevant now as we were when we were founded in 1975, and some of those, challenges are unfortunately very similar to what we were facing in 1975. And so I think that, to me, it's pretty simple in that we want to continue to facilitate the empowerment of Chicago communities by continuing to listen to them and, provide the collaborative services we do as those services will continue to respond. We want to still be here in 50 years.
Yeah.
Who knows what the challenges will, be then. Hopefully they're not the same ones now. Hopefully not the same ones as in 1975. But I think that maintaining our model as it needs to adapt over time is really at the core of our work right now.
That sounds great. I mean, just continuing to listen and be innovative to meet those needs sounds exactly like what we all need in our community. So, as we also look at sustaining you all, how can people get involved and access your services, whether it's, someone that's just eager to say, I want to raise my hand to help, or if they're actually interested in understanding more of what they might be able to tap into with all of you?
Yeah. I'll say for everyone, we want to meet them where they're at. And our clinic is located in Uptown. It's not a walk-in clinic, it's by appointment only, but you can learn about the full scope of our services on our website. We're very Googleable, we pop right up if you put in Chicago Women's Health Center. But yeah, we are really eager to have folks be part of this work, whether that's just telling someone that they heard this conversation today, or word of mouth is still how most people find us and access services. But we are always, former volunteer coordinator. So grateful for, want to continue to bring on new volunteers and the energy that comes with that, especially volunteer providers have been one way in which we've been able to meet some of the volatility of the healthcare landscape over the last few years. So send volunteer providers our way if you know anybody who would want to be part of our work in that way. Board members and, of course, staff. So
we have events. Follow us on our Instagram account, Chicago Women's Health Center. You'll find links to it through our website, chicagowomenshealthcenter.org. We have events. We want to see people out there. We want to meet you. You can connect with me. Would love to hear about other like-minded, like-valued organizations who might be able to connect with us and build more opportunities for expanding healthcare.
Absolutely. That sounds great. And I think we're just wrapping up with our time today, but I want to extend my heartfelt thanks to both of you for the incredible work you're doing at Chicago Women's Health Center. To all our free and charitable clinic partners in Chicago and across Illinois, thank you for helping to make our communities safer, healthier, and more responsive with what you're doing to innovate and meet those needs in our communities. I also want to thank our folks here at CAN-TV's Nonprofit Services for their support and production of this program. My name is Megan Phillip, and thank you for watching Community Pulse, which airs on Channel 21 and is also available to stream on cantv.org. We will see you next time.
Thank you.
Thank you.
Thank you.